Polymyalgia Rheumatica, or PMR, is an autoimmune disease which can cause significant pain and stiffness in the muscles around the shoulders and hips. The greatest risk factor for PMR is age, with virtually all patients over the age of 50, most older than 60. Women are twice as likely to develop PMR than men. Most patients with PMR describe pain and stiffness worse in the areas around the shoulders and hips, muscles equal on both sides. Some patients describe weakness, although it is pain which is limiting strength. The pain often limits mobility and day-to-day activities. The stiffness can be profound, usually worse in the morning. PMR can usually be diagnosed by a rheumatologist after he or she performs an appropriate history and physical examination with you. Your physician will also do a blood test, checking for markers of inflammation in the blood. While these are not specific for PMR, they are usually elevated in patients who have this diagnosis. PMR is treated with a low-dose steroid, prednisone, usually starting at between 10 and 20 milligrams per day. Higher doses are not needed and could actually make things worse. If the diagnosis is correct, most patients will feel at least 90% better within a week, if not a phase. Most rheumatologists will slowly lower the prednisone over 6 to 12 months until it is stopped. By decreasing the dose slowly, it prevents recurrence of symptoms and allows patients to remain in remission off medications. You should not decrease too slow either. You should not need prednisone for years. Further investigation to ensure the right diagnosis or an alternate treatment should be considered if you can't stop it. Because patients will be on prednisone for more than 3 months, there is an increased risk of developing osteoporosis. Patients should be instructed to take supplemental calcium and vitamin D daily. Most patients are also prescribed a bisphosphonate, a class of medication which reduces the risk of thinning bones.